World AIDS Day, observed on December 1st every year, is dedicated to raising awareness of the AIDS pandemic. And in South Africa, Durban city volunteers have long cared for HIV/AIDS patients and orphans. Although these Zulu volunteers may not have received much education during their lifetime, they're nevertheless more willing to reach out to those HIV/AIDS patients than most are.
Despite the rain, this is a journey they must continue. The clamour inside the house, believe it or not, is because of AIDS. This team of Tiji volunteers often comes across AIDS patients like Bajabulile Nwasa during their home visitations. Dressed in a white robe, Tiji volunteer Nomusa Lutuli, who is also a pastor, knows how to console and bring comfort to the sick and suffering. Volunteers first take the necessary safety precautions before they get to work, boiling hot water to give Bajabulile a bath. Among the volunteers are also those who are HIV/AIDS sufferers themselves. Kinsile was also once a recipient of Tiji's care. Once her condition became more stabilized, she decided to follow in the volunteers' footsteps.
From then, that's why I decided to join that sushi company or what? Sushi Foundation. I don't have any problem so far to the other patients because I used to tell them that even myself I'm affected. So that's why I found it is easier to help them because I used to tell them that I'm still okay.
The population of South Africa represents 0.73% of the world's total population, yet those infected with HIV/AIDS accounts for 70% of total cases worldwide. In other words, 1 in every 10 South Africans is a carrier of HIV. And yet, when it comes to AIDS research and prevention, the South African government lacks a concrete strategy. Since 2001, a group of predominantly Zulu Tiji volunteers began caring for HIV/AIDS patients and orphans. Their care has extended from home visitations to providing hot meals. Today, there are 1,200 HIV/AIDS patients and 7,500 orphans whom the Zulu volunteers have taken under their wings. The volunteers play the role of a mother as well as that of a friend. Nkosi Johnson was a South African child diagnosed with HIV/AIDS. When Nkosi was 8, a school refused to accept him as a student because of his HIV-positive status. Nkosi passed away at the age of 12, and at the time of his death, he was the longest surviving HIV-positive born child. And in the words of Nkosi Johnson,